This is Nurse Mo from ROFEM. Let's talk about thyroid storm. Thyroid storm is also known as thyrotoxicosis and thyroid crisis. The issue starts from the thyroid gland, and hyperthyroidism is the underlying problem. Let's take a look at what the thyroid gland does. The thyroid gland produces and releases thyroid hormones that regulate body temperature and also metabolism, and it also controls our rate. Now, for some people, their thyroid gland may produce too much. When this happens, it is known as hyperthyroidism. In a person with hyperthyroidism, their metabolism is very, very fast. They have heat intolerance, their heart rate is going really high, and their blood pressure is going very high as well. They are very irritable. They may react very harshly to little things. All of these are due to the high levels of thyroid hormones that have been released into their body. They are also very nervous. Their GI system is very fast. They could develop diarrhea. Now, in thyroid storm, the thyroid gland releases a large amount of thyroid hormones into their blood. Now, it is very important to know that thyroid storm is very serious. Thyroid storm is life-threatening. It is a medical emergency with a very high mortality rate. Now, when a person goes into thyroid storm, the large levels of thyroid hormones that have been released into their body greatly speed up their metabolism. And because of this, the body will need more oxygen to catch up with a high-speed metabolism that is going on in their body. The body gets oxygen supply from the blood that is pumped by the heart. So, in order for their heart to meet their body's oxygen need, it has to beat very fast. That is tachycardia. Now, when we look at that very, very deeply, when the heart keeps beating too fast, continuously, that's not good. It can lead to heart failure. How do people develop thyroid storm? Anything that increases the metabolism in the body of someone who already has hyperthyroidism can lead to thyroid storm. Now, a person with hyperthyroidism can go into thyroid storm, say, for example, after thyroidectomy, when the doctor surgically removes the thyroid gland, or if the person suddenly stops taking their anti-thyroid medications. Infection can also do it. Infection can send a person who already has hyperthyroidism into thyroid storm because infection puts the body to work very hard in order to fight the pathogen that is causing the infection. Trauma can also do it because trauma can trigger a stress response in their body that is going to result in increased levels of stress hormone, cortisol. Acute illness can do it, and so also emotional stress. All of this can trigger thyroid storm in a person that already has hyperthyroidism. Now, let's take a look at what thyroid storm feels like. A person who has developed thyroid storm has a sudden and extreme elevation of all of their body processes. Their temperature may rise all the way up to 106 degrees. They will be very hot and sweaty. Their heart is beating so fast, it's beating as fast as 200 beats per minute. Blood pressure is very high, hypertension. Their respirations are fast also, and they're very anxious, and blood glucose is also going up, hyperglycemia. They have abdominal pain and they are very, very confused. Now, if this condition is not relieved, this person can go very quickly from being very confused to a coma, and they could die from heart failure. How can we correct the situation to prevent death from multi-organ failure? Treatment of thyroid storm must start as soon as we take note of their first set of symptoms. We must maintain a patent airway. That's very, very important. Their temperature must be reduced. Cooling blankets may be ordered by the doctor. Medications to slow down their heart rates will be ordered as well. For example, propranolol. Anti-thyroid medications also will be ordered for them. PTU is an example of this one, and this one will be ordered to prevent further release of thyroid hormones from the thyroid gland. They will also need medications that will help them to slow down their brain activities. This medication will help them to reduce restlessness and anxiety, and it will help them to calm down. They will also need Tylenol and steroid, and all of these may be ordered by the doctor. Now, because their metabolism is very fast, IV fluid will be ordered for them to support their body processes. Otherwise, serious dehydration or vascular collapse may result from there. Now, let's look at these questions together. For a patient with thyroid storm, which medication will the doctor order to block sympathetic nervous system effect and slow down their heart rate? That's question 1. Now, question 2, the nurse who is caring for a patient receiving anti-thyroid medication, PTU, for several weeks should monitor the patient for which specific adverse effects of PTU. Leave your answers in the comment section. I will do another video to discuss the answers very soon. Thank you so much for watching this episode of Dose of Nursing by Rofem. Like and subscribe to stay updated. If you have any questions, you may drop them in the comment section. See you next time.